What is self-medication? When you self-administer or treat for physical or mental conditions, it's called self-medication. What happens when parents medicate their kids using OTC or over-the-counter drugs or refill old prescription without consulting? Ear, nose, throat. What you should not do. That's what I'm talking about today. This is Dr. Amrita and you're listening to the Health Wellbridge podcast. What are you supposed to do when it's late? You have a earache and you can't visit a clinic? A few incidents to give the background behind this post. One of my patient's mommy told me today about how her 2-year-old girl's ears were aching since 5 days. And she decided to give her some medicine. The medicine was an antibiotic prescribed from another doctor's year-old prescription. The mommy also used one of my year-old prescription to buy ear drops to give into the child's ears. Now this ear drop was prescribed for most probably a different reason, and the child now started having ear discharge mixed with blood. None of the prescriptions were available. The mother was able to name the antibiotic she had given the child but was unable to recall the name of the ear drop. This is not very uncommon. For the sake of privacy, I will not be mentioning the personal details or the gender of the child. Now the case 2. I had prescribed an ear drop for ear wax 6 months back. The child had gotten better, the ear wax had dissolved, the ear was better, but some of the ear drops were apparently left. The patient was only 12 years old. So the parent applied the same ear drop 6 months later for a sudden earache. They had no idea whether this earache was related to earwax or not, but since that ear drop was left, decided to just try putting it in the ear. I was speechless again. In both these cases, the children were in severe pain. The parents were very upset and I was confused because they did not have the prescription from which they were refilling. The doctor's prescriptions was not available with them, but they were confident that they had done the right thing by self-medicating with those medication. In this case, on their kids, not on themselves. The poor kids were suffering. Case number 3. Mommy used to suffer from a stuffy nose. She used a over-the-counter nose drop, a very popular one, which I'm not going to name, for many years. If she didn't use the nose drop, she was unable to sleep. The child started having a stuffy nose with the change of season. The child was only 2 years old. Mommy started giving the child the same adult concentration nose drop. Mother obviously had aggravation of a stuffy nose symptom and the child started feeling stuffed up too. He kept pointing to his nose and couldn't breathe clearly, which was obvious from when he was sleeping. His nose started making noises. This condition of aggravation of nasal stuffiness due to nasal drop is very common. It's called rhinitis medicamentosa, when nose problems get worse by self-medication and overuse of OTC nose drops. This rebound nasal stuffiness, when occurring due to OTC vasoconstrictive nasal drops, is surprisingly common for many patients with allergies too. What could be behind self-medication and parents medicating their kids without medical consultation? The reasons are deep-rooted, psychological, social, multifactorial, and sometimes are a cause for people shouting about their rights to choose or not to choose to use healthcare. As parents, you and I want to help our kids the best we can. With online healthcare access, many such problems can happen, but still have access to good clinical skills. That's why with the advent of telehealth, problems like this can be managed better and you do not need to self-medicate. The problem of random self-medication is worrying, but when it's your kid, you need to be triply sure. You have to remember a few things. Number 1, never ever use ear drops, nose drops, eye drops, ointments after their expiry date. You never know what's going to happen. Always use these drops or ointments within 1 month of opening the seal. This is very important because sometimes when you open the seal, the active ingredients are spoiled with passing of time, and when you are again using it after say 6 months, 1 year, they no longer work and you think this medicine is not working. They can also cause other kind of reactions, allergies, complications and whatnot. Always use these drops and ointments within 1 month of opening the cap to avoid problems. Never self-medicate when it's your sense organs because the harm which you cause could be irreparable. Never self-medicate when it's your kid because they are often not able to pinpoint what the problem is and what is that they are suffering. So, it's better we don't self-medicate our kids. Never use or reuse your old prescription without consulting your doctor. Never reuse prescriptions of your family member who may or may not have suffered from conditions which you are suffering now. Any pain which keeps you awake is serious, so consult a doctor. Even OTC drugs, nutritional supplements can cause trouble. Side effects, complications and drug reactions all occur when taken alone or in combination with prescription drugs. Any condition which persists beyond 2 days in kids needs checkup. Anything which doesn't get better within 2 weeks often need a blood and other tests. If you have a pre-existing medical condition, always know when you should follow up. Get teleconsultation done if you're unable to visit in person. All government medical colleges in India have a free emergency room healthcare service available. You can easily access that if you really need emergency medical attention. Diabetes makes all infection worse, so take good care of your blood sugar. Don't self-medicate unless you can self-manage the complications. It can cause unintentional permanent harm. Choose your healthcare with care because this is the only body you have. Some other ENT topics which will help you are in the description box below. You were listening to Dr. Amrita on Health Wealth Bridge podcast.
Health Wealth Bridge Flash does not provide medical advice and is for informational and educational purposes only and is not a substitute for professional medical advice, treatment or diagnosis. Call your doctor to receive medical advice. If you think you may have a medical emergency, please dial your local emergency response phone number. Thank you.